with shortness of breath and fever since 1 month, and recently developing abdominal distension as well as tightness. And then when we did the x-ray, we found a large pleural effusion. Now you can see that my probe, you can show the probe also, is in this intercostal space posteriorly and over the pleural tap area. We did a pleural tap in the morning, it was showing pus, and it is there over the pleural tap area. And if I go a little bit higher up, it is the lungs here. You can see the lungs here, and the liver is also around. So lungs, and then the pleural space, and the fluid which was like pus around the liver. If we go down further, so again the lungs here. We have not gone down, we have actually gone up because we could not go down. Okay, now we will see her heart. So now, yeah. So look at that. Big posterior pericardial effusion. Not so much in the anterior space, but yeah, there is some amount in the anterior also. Otherwise the heart looks okay, the LALV, everything is looking fine. But this pericardial effusion is the most thing, and this is the dorsal aorta. Now we can turn it around. Again the posterior pericardial effusion is very, very prominent here. You can see that. And there is some inflammatory hint by the bread and butter appearance which you can see here. This is the bread and butter appearance. Lots of inflammation here as well. And we have seen that there is no cardiac tamponade by freezing this and seeing it in diastole. There is no RV diastolic collapse. This is not collapsing, so we don't need to do an urgent pericardiocentesis. And so this is the story of this 27-year-old woman who had fever, PUO since 1 month, along with currently features of abdominal distension and vomiting and diarrhea. And shortness of breath? No shortness of breath. Okay. Do we have a fever documented? Okay. Now we'll just look at the ascites here. And surprisingly, there's a kidney here. Just we are above the kidney. Why is the kidney floating here? Very strange. Anteriorly floating kidney. No, AKI will not make the kidney float here. Kidney mundu emena ibbandi unda? See, the kidney is here. She's got a renal problem, I mean congenital. Very strange. Seeing it in the anterior space. Yeah, so this is the gallbladder, liver, and kidney coming in anteriorly here. Yeah, it looks quite big, but yeah, only thing is it's coming well visible anteriorly, that is. I'm not sure, maybe because of the ascites or something is part. So this is the spleen here, spleen here, and this is the kidney, and the fluid. So although it looks distended and all, you see the ascitic fluid is not marked. We didn't find any fluid here except this part. Yeah, this is basically the hepatorenal pouch of Morrison actually. Yeah, hepatorenal pouch of Morrison. Some fluid is there, otherwise not much fluid. So really not much fluid is, that's why it's distended by flatus. That's why she's having pain and vomiting and all that. Some obstruction is there. Now, why obstruction? Very commonly, if it's disseminated cox, intestinal obstruction. Very common. Okay. So we have to quickly make the diagnosis and start around ATT.